Good morning, sir. I am Chris Madel Tayopon, your nursing aide for today. And today I will going to demonstrate the procedure using pulse oximeter or measuring oxygen saturation. Purpose, to estimate arterial blood oxygen saturation and to determine the presence of hypoxemia before the signs develop. Equipments needed: pulse oximeter, alcohol wipes or disposable cleansing cloth, and nail polish remover. For assessment, observe first the client for any signs and symptoms associated with alteration in oxygen saturation. Then assess for the factors affecting the or influencing the measurement of SpO2. Next, for the planning, we need to verify the client's identity using two methods. If the client is conscious, we can verify the client from him. Then, if the client is unconscious, we can check the hospital bracelet like this. It has a name, age, sex, and the date. Then we can ask the relative if they are present. Also the chart, it has verification on it. Then perform hand hygiene. So before coming here, I'm finished performing hand hygiene, so we have to proceed implementation, which is select an adequate site for application of sensor. Then we can use the patient's index, middle, or ring finger. Then check the proximal pulse and capillary refill at the pulse closest to the site. So how to do it? Pinch and release. Then if the circulation at the site is inadequate, consider using the earlobe or the bridge of the nose. And use only at 2 if the lower extremity circulation is not compromised. Then afterwards, select the proper equipment. So if one finger is larger than the probe, we need to select smaller one. And we need to know that a per pediatric probe may be used for smaller adults, but it's better for us to use probe appropriate for patient's age and size. Then next, check if patient is allergic to adhesive. A non-adhesive finger clip or reflectance sensor is available. Then we need to prepare next the monitoring site if applicable. Then cleanse the selected area with alcohol wipes or disposable cleansing cloth. Then allow the area to dry. So we need to clean the area with then if necessary, remove nail polish and artificial nails after checking the manufacturer's direction or instruction. But for my case, it has no, so let's proceed. But if it has a presence of nail polish or artificial nails, we need to ask the consent of the client. So afterwards, apply probe securely into the skin. Make sure that the light emitting sensor and the light receiving sensor are aligned opposite to each other. Then not necessary to check if we use the earlobe or the bridge of the nose. Then we need to connect the sensor probe into the pulse oximeter if applicable. Then we need to turn on the pulse oximeter and check the beeping sounds, fluctuation, bar lights, or waveform on the phase of the oximeter. But in this oximeter, no beeping sound or no sounds we hear. So let's proceed. So we need to set alarms on pulse oximeter if possible. Then check the manufacturer's alarms limits for the low and high pulse rate setting. Next, check the oxygen saturation at regular intervals as ordered by the physician. Then, the signal by alarms, and we need to monitor the hemoglobin level. So, as for this SpO2 readings, it's 98% and 92 pulse rate. So, it was normal because 95 to 100% is normal. Then, 80 to 90% tissue damaging. Then, the 75 and below, it was life-threatening. So, we need to check to have accurate information. Then, we need to remove the sensor for regular basis and check for the skin irritation and the signs of pressure. So, we need to check it every 2 hours. But in spring tension, every 4 hours. And adhesive finger or the 2 sensor. Then, clean non-disposable sensors according to the manufacturer's directions and perform hand hygiene. So, after remove it, we need to turn off and clean. Then for evaluation, so compare SpO2 readings with patient's previous baseline acceptable SpO2 values. Then for documentation, record the SpO2 value on vital sign flow sheet in narrative form, in nurse's notes. Also, record any signs and symptoms, alteration and oxygen saturation in narrative form in nurse's notes. Also, lastly, we need to report any abnormal findings to the present healthcare provider. That's all. Thank you.